Welcome to Orion Health Series presented by Beaumont. Today's topic is lymphedema. What is it? My name is Jay Kline, Senior Physical Therapist at Beaumont Health Systems, Troy Hospital. And today I'm interviewing Janet Weichec Seidell, Supervisor of Rehabilitation Services at Beaumont Health Systems, Troy Hospital. Janet is lymphedema certified and health coach trained.
Hello, Jay, and hello, Lake Orion. Before we begin today to talk about lymphedema, what is it? I would like to explain our lymphatic system. It's the body's immune system. It has lymph nodes that filter fluid and waste products from the body. It transports fluid from tissue space to the circulatory system. It's like our wastewater treatment plant. An example is when you have a bruise and it gets black and blue and then it gets discolored and starts to get brown. As it's dissipating, that's our lymph system at work, taking those waste products, those dead cells, and filtering them and bringing them back into the circulation. So that is our lymph system at work. Our lymph system is part of our circulatory system. The venous system and the lymphatic system work together. The venous system returns about 80% of the fluid back to the heart. The lymphatic system returns about 20% back to the heart. Venous system circulates blood back to the heart, and the lymphatic system circulates lymph fluid back to the heart.
Okay, Janet, now that you've shared the body's lymphatic system, about the body's lymphatic system, can you tell us what lymphedema is?
Lymphedema is swelling or accumulation of the fluid in a body part due to an impaired lymphatic system. Our body becomes impaired and it decreases the ability to drain or circulate the lymphatic fluid efficiently and effectively. This condition can affect both men and women. It could be a side effect from cancer treatment, and it can be managed similar to other chronic conditions like diabetes.
So what causes lymphedema to occur?
Well, there are primary and secondary causes for lymphedema. As you can see on the slide here, primary lymphedema, it's congenital or hereditary. So that means you were born with it, some abnormality that occurred in your lymphatic system. The onset can occur at any age. It could be seen at birth, puberty, childbirth, and even menopause. And it commonly affects the lower legs, but it could affect the arms too. Then there is secondary lymphedema. This can be caused by surgical removal of lymph nodes with or without cancer, radiation treatment, trauma, such as like in a motorcycle accident or a biking accident when you fall off and you kind of slide against the pavement and you get that shearing force of the skin that can affect our lymphatic system and cause lymphedema. Through infection in the tissue space, if you've ever heard the term cellulitis, that's an infection in your tissue space and that can occur and cause lymphedema. And then chronic venous disorders can affect lymphedema. Again, on the picture here, you can see an example of secondary lymphedema, status post-breast cancer. On the left, you can see the before treatment, on the right, the after treatment. There are various stages of lymphedema. There's early onset stages, and then there's more advanced stages. In this early stage, you can see a before and after in the lower legs. And so the before and then the after the treatment. Then you can have even more advanced lymphedema, and here's an example in the legs, a before treatment, and then 2 years later. So this patient was more advanced stage, and over the course of 2 years, we were able to get the legs down to that near normal size and more functional mobility. I would like to focus on one of the secondary lymphedema stages, latency stage. That is an early stage, and that is when we are at risk for getting lymphedema, and there is no visible signs of swelling yet. And so a case that I'd like to focus more specifically on is breast cancer. When patients have breast cancer treatment and they have lymph nodes removed, and then they could have radiation or not have radiation, that puts a female or a male at risk for lymphedema by having those lymph nodes removed and having the radiation. And so we have screening programs that we can screen and monitor people for being at risk for lymphedema, and to keep an eye on them so that if it does begin, we can get it under control and into treatment right away. Often people ask, especially in the breast cancer population who've had commonly lymph nodes removed and radiation, will I get lymphedema just because I have breast cancer? How do I know if I'm at risk for lymphedema? Right now, the only evidence out there that shows a correlation of someone being at risk for lymphedema is with an increased body mass index. So the correlation with increased body mass index shows an increased prediction of lymphedema risk.
Okay, Janet, I think you mentioned this before, but can you explain if lymphedema is treatable?
Yes, lymphedema is treatable. It's a chronic disease that can be managed, like I mentioned before, similar to diabetes. It varies depending on the classification or the stage of the condition. Overall health condition, so depending on what other health issues you have going on, could minimize or increase the stages. And then the ability to self-manage. Can you do it on your own, physically, cognitively? And then also, if you can't do it on your own, do you have the support system, such as a family member or caregiver, that can assist you in the management of this condition?
Okay, Janet, so what are the effects of lymphedema?
Well, lymphedema causes swelling, and we have swelling present. And with that swelling present, it can cause damage to some of the tissues. It can cause the skin to become more fragile. You can have discoloration. You can have skin changes. The skin can become more fragile and tear easier, which then puts you more at risk for infection. As I mentioned here, the increase in infection or cellulitis that I talked about earlier. So think about your arm or your leg and look at your normal size. And then when you have swelling present, think of it like a pond. And there's just this fluid sitting there settling. And so it's a breeding ground for bacteria and your waste products just to breed off of each other, and can be a breeding ground for infection. We want our lymphatic system in our body to be flowing like a river, and that fluid flowing so that those waste products and toxins flow out of your tissue space and back into the heart as part of circulation once it's filtered through our lymph nodes. Also, the presence of swelling can cause impaired mobility to our joints, such as in the shoulder, difficulty reaching into the cupboard. Simple things such as just getting dressed in the morning, washing our hair, getting ready for the day, our morning routine, or even with our legs, difficulty walking, lifting your leg to get in and out of the shower or the tub, and lifting your leg to get in and out of the car. All these basic things that we just take for granted in our daily activities, when that swelling is present, it can affect that motion in the joint, and it can affect our functional mobility.
So what are the symptoms of lymphedema?
People often describe a feeling of fullness or pressure in the arm or leg, observable puffiness or swelling. Let me expand upon swelling, because there is edema and there's lymphedema. And lymphedema is when you have an impaired lymphatic system. So if you have swelling present, it's not always lymphedema. You have to have an impaired lymphatic system from either the primary or the secondary causes that I described earlier. If you don't have an impaired lymphatic system and you have swelling and fluid retention in your tissue space, that would be edema.
Janet, how does one diagnose lymphedema?
Well, you would go to your physician, and your physician would do a history and physical, and then they would write a prescription to go to physical therapy. And then you would want to find a lymphedema certified physical therapist, and they go through specialized training to become certified. So that's why you want to make sure you're going to a certified lymphedema therapist, so that they are addressing your lymphedema in the best route and the best treatment plan. Our goal is to reduce the swelling and get your body part or your limb to as near normal size as possible and get you to return to functional mobility. The treatment is known as complete decongestive therapy, or CDT. In complete decongestive therapy treatment, or CDT, a therapist is going to do manual lymph drainage, compression bandaging, patient education, therapeutic exercise, and fitting for a compression garment. With manual lymph drainage, it's a gentle manual technique It reroutes the lymph fluid to our healthy lymph vessels back into our circulatory system. It's not a massage, it's a drainage pattern. It's a very light touch technique. Then there is compression bandaging, and we use a short stretch bandage. Most people say, well, I got ACE wrap, I can use that. And ACE wrap is an example of a long stretch, and when you're dealing with lymphedema and reducing swelling, you want a short stretch. So it's a specialized bandage that is used to put pressure on outside the swollen body part. It helps decrease the swelling, and it helps break down hard scar tissue that might be present from the swelling being present in that body part. In addition, near the end of your treatment, as we get closer to self-management, you may be prescribed a compression garment, and this can be obtained from your medical supply company, and that prevents reaccumulation of evacuated lymph fluid back into the lymphatic system and prevents it from settling back into that limb. When you have a swollen arm or leg, the tissue gets stretched out, so depending on how long you had that swelling present, it takes time for that skin to reshape and remodel and the elasticity to go back into place. So the compression helps with that portion of the treatment so that the fluid doesn't just go back into that area through gravity and use of the arm.
That's interesting. Do physical therapists instruct the patients and the family members?
Good question. Patient education is one of our key components of our treatment program. We get patients involved in home education, home management programs right from the start, from day one, and we welcome the families, caregivers at any time. We believe patient and family home education is very important to the success of this program and compliance with the program. So we're teaching all those same techniques I just talked about, how to do your self-manual lymph drainage, your self-bandaging, skincare precautions, which are very important. I mentioned before about infections, therapeutic exercise, and then we do health coaching to help on lifestyle changes to minimize risk. Our goal, again, is patient family to independently self-manage their lymphedema. Then we come to the exercise piece, which is another very important piece of the lymphedema treatment. A physical therapist will prescribe an appropriate exercise program based on your individualized lymphedema condition. People are always hearing and reading that they need to exercise, but most people say, I don't know how to. Where do I begin? People are fearful of going into a gym. They're intimidated. They're scared to use machines. Often people will say, I have this bike, I have this treadmill, but I don't know what to do. I don't want to make my condition worse. So exercise is a very important part. When you're actually using your muscles, you're moving your arms, you're moving your legs, you get a muscle pump effect, and that causes the blood and the lymph fluid to circulate and go back into circulation. It helps our cardiovascular status. And so exercise is a very important part of the treatment plan, but also is doing safe exercise, because if we do exercise incorrectly or we strain a muscle, it can exacerbate our swelling, our lymphedema, or it could create an onset if you're at that at-risk stage. Also, why exercise is so important, if you remember, I talked about in secondary lymphedema that the only evidence that's out there right now with correlation to increased risk of lymphedema and post-breast cancer treatment was an increase in body mass index is a predictor of increased risk of lymphedema. So exercise is one way to maintain or reduce that body mass index. So again, your physical therapist will set you up on a safe and appropriate exercise program. And then the goals, as we mentioned, is to maintain normal or near normal size of your swollen body part. We want to achieve functional return to activities of daily living and get the patient and family independent in all aspects of our self-care and management techniques of lymphedema.
Thank you very much, Janet. You've been very informative. If one were looking for greater resources or for more information, where should they turn to or where should they look?
Well, at Beaumont, in our system of Troy, Grosse Pointe, and Royal Oak, we have 15 certified lymphedema therapists in our Beaumont health system. And for your convenience, in your backyard, we have Lake Orion Physical and Occupational Therapy Clinic in the Beaumont Medical Building on Lapeer Road. And on your screen, you can see the phone number listed, 248-656-4644. 4330. Again, that's the Lake Orion Physical and Occupational Therapy Clinic in the Beaumont Medical Building on Lapeer Road, 248-656-4330. In addition, we have listed on the screen other Beaumont Health System resources. We've got the Wilson Cancer Resource Center at Beaumont Health System Troy. We have the Rose Cancer Center at Beaumont Health System Royal Oak. And then there is the Sharing and Caring Support Group for the breast cancer through the Beaumont Health System. In addition, outside of Beaumont, there is the National Lymphedema Network, which is listed with www.lymphnet.org, as well as a 1-800 number listed on your screen. There is also the Lymphatic Research Foundation, the American Cancer Society. So if you have any questions, feel free to contact us. Our contact information is listed on the screen. J.W. Seidell at beaumont.edu.